Hey Freedom Lovers, this is Dr. Peterson Pierre with America's Frontline Doctors, bringing you today's Daily Dose. In late 1985, retired research scientist Dr. Vera Shibner suggested to Leif Carlson, a biomedical electronics engineer specializing in patient monitoring systems, that he develop a breathing monitor for infants. As she wrote in Consumer Health, the monitor goes under the mattress and records the infant's breathing whenever the child is in the crib. The breathing can be consistently monitored for weeks and gives a computerized readout. At the time they embarked on the project, researchers studying sudden infant death syndrome believed it was an innate fault of the child's breathing control center in the brain. As such, many parents were interested in having their baby's breathing monitored. CotWatch sounded an alarm when there were pauses in infants' breathing and low-volume breathing. When they first gave new parents monitors, nothing happened for 2 months, and then parents reported that alarms started going off. When she asked what had happened around that time, parents said their child had been vaccinated. They had also given the parents forms to fill out, and when she reviewed them, she saw a pattern emerge. When they brought their findings to pediatricians, they thought they would be pleased to understand the cause of SIDS. However, much to their surprise, the pediatricians were not happy at all. The pattern that emerged shows that stress-affected breathing occurs on critical days following vaccination. In an article published by SaneVax, medical research journalist Desiree L. Rover discussed Shibner's findings. She explained that they dovetail with the earlier research of Dr. Hans Selye, who showed that in an attempt to undo the damage, the body responds to noxious substances in a typical stress syndrome. In 1937, Rover wrote, researcher Dr. Hans Selye discovered that when a human or mammal consumes or is injected with a harmful substance, the body reacts in a predictable sequence of phases known as the nonspecific stress syndrome in an attempt to counteract the damage. Later, while analyzing data from CotWatch, Dr. Shibner noticed patterns that align with Selye's stress syndrome response. She found that vaccination consistently triggered a sudden spike in breathing alarms among infants. By examining computer-generated records, she was able to pinpoint critical points within these patterns and compare them to documented cases of sudden infant death. Around 1990, this led her to an unexpected discovery: a clear connection between vaccination and SIDS. Her analysis also suggested that younger infants succumb more quickly to the toxic effects of vaccines. Considering the evidence, does the CDC acknowledge a relationship between vaccines and SIDS? What is its official position, and what do vaccine manufacturers say about the association? Well, you already know the answer to that. Ladies and gentlemen, only the truth will set you free. Stay tuned for the next Daily Dose.